Hello, good
Hi.
afternoon once again. We are live on Facebook and live on YouTube as well. And today we are talking about prematurity, all you need to know. So I'm just waiting for a few people to join before I introduce my guests. You can see here already. So while I'm waiting for everyone, let me just take a minute to talk about Baby Child and Co. Baby Child and Co. is an organization that does child health education. We do this by blogging. So our blog is babychildandco.com. And then we also do YouTube videos. On our blog, we have a parenting club that you can join. We give you personalized guidance. Personalized because it's according to the age of your child. We don't charge anything for it. We reach you every week via email and sometimes via WhatsApp. And then we give you information. So if you have a newborn, we are going to be guiding you through things like breastfeeding, newborn jaundice, hiccups, colics, those sort of things. When it's time for weaning, we'll take you through the milestones. When it's time for weaning, we are talking about weaning and so on and so forth. When it's time to walk, we are checking, are you walking, and all those sort of things we do for you. And it's free. You don't need to pay anything for it. We just want to give you information to help you as you parent your child. And then we have a forum where you can come and ask all your questions. It's free. I am there. We have some experienced parents there as well. And then they will help you to answer your questions as well. I mean, it doesn't replace a hospital because a lot of things or certain things still need to go to the hospital, but we have guidance for you as you go through this journey of parenting. I'm also just taking a moment to share on my Facebook page. If you have joined us, please share to your Facebook page so that your friends can see as well, and then they can also share from there. Yes, so we are still just waiting for a few more people to join, and then we can start. And as soon as you join, please share because we want everyone to hear the information we are talking about. So today we are talking about prematurity, and we have somebody, a resource person who is well versed in this topic to take us. She's going to tell us everything that we need to know as parents to empower us to care for our babies when we have premature babies. So that's what we are going to do today. And now that I've seen that a few people have joined, I'm going to just introduce my guest. And okay, so those who have joined, kindly share to your walls, to your pages, so that your friends can also see as well. Okay, so I'm introducing to you Dr. Sally Owusu-Abinu. Sally is a pediatrician, and she's currently in Cape Town, South Africa. She's training as a neonatologist, so that's a pediatrician who takes care of newborns, and prematurity is well within her domain. So you are very welcome, Dr. Menu, and thank you for accepting to do this for us free of charge, so that we empower our parents, and if they have premature babies, then they know what to do about them or for them. Yes.
You're welcome,
Okay.
Preterm, and I'm happy to be here.
Thank you. So if you joined us, you can leave your questions in the comments and then we'll read them and we'll try and answer them as well. Any question at all that you have, as long as it has to do with prematurity, please put them in the comments. And we have a comment from Joyce Auku who says that it is good to be here again. She's one of our regular viewers. If you have a question, please leave it and then we will attend to it. So we had some questions from parents already that we can start to answer. Quite a few parents were interested in the underlying factors of prematurity. So I think we will talk about what prematurity is, and then we will talk about the causes of prematurity.
Okay, all right. So prematurity simply means that a baby is born before 37 weeks. So you know the way you go to the hospital and then your pregnancy is timed or it's age. They'll tell you are 24 weeks today, you're 25 weeks today. say, if you deliver before your pregnancy is 37 weeks, then we say that you have delivered a preterm baby or you have had a preterm delivery. So that is what prematurity is all about. Well, there is also the element of whether the age of viability. I think I won't go into to that so much, but any baby that is born before 37 weeks is said to be a premature baby. Now, after the courses, there are lots of courses, or we actually do call them risk factors, because you really can't say you can't be 100% certain that this is the reason why a baby was born premature. But we know that there are certain things or there are certain conditions that when you have them, you can, or it puts you at a higher chance of actually delivering a preterm baby. Now, I think when it comes to preterm deliveries, one of the first things that we need to know is that it's not every preterm delivery that is spontaneous. So there are those pregnancies that we actually interfere with the pregnancy if we think for some reason the continuing the pregnancy would put the mother or the baby's life at risk. So there's that arm of prematurity where we say that it's hospital or we actually induce it. Exactly. One of the commonest causes is when the mother's blood pressure is going so high. You think in that condition, the only way in which you can actually have safeguard the life of the mother is to actually deliver the baby. So there are times when doctors actually interfere with the pregnancy for the sake of the baby or for the sake of the mom. And then we have those other causes, which are the spontaneous causes, which I would then, I think now tell you about. I don't know if I'm explaining myself very well. So there's the arm where the doctors interfere with the pregnancy, and there's the arm where mothers just go into spontaneous preterm labor. So, like I said, a lot of preterm deliveries really don't know why the pregnancies actually halt at a particular point in time. So that's one thing to bear in mind. You may do everything by the books, go according to everything that you are told, and still end up with a preterm delivery. So for those ones, you really can't do much about them. But then there's also the arm where certain things actually increases your chances of having a preterm delivery. One of the first things is infections, especially in our setting. If a mom has an infection, especially a urinary tract infection. So if you're pregnant and then you start having some lower abdominal pain, you're passing urine and you have some pain, that's one of the signs that suggests that you may have a urinary tract infection. You want to go and see your doctor, and then you want to get treated as soon as possible. Otherwise, that infection can make you deliver your baby preterm. Apart from that, it's also well known that if you've had a preterm baby before, you have a higher chance of having another one. So it's said that the percentage is about, if you've had a preterm delivery, the first preterm delivery, you have about a 15% chance of having a second one. And if you've had 2 preterm deliveries, you have about a 40% chance of having another preterm delivery. And even if you've had 3 preterm deliveries, you have about a 70% chance. So sometimes the fact that you've had a preterm delivery already puts you at risk of having another one. Then there are those conditions of moms that predispose them to actually having preterm deliveries. Like if you have a mom who is hypertensive, chronic conditions like hypertension, or sometimes even hypertension that actually starts in the pregnancy, what we call gestational hypertension, can actually lead to preterm delivery. Diabetes, chronic conditions like thyroid conditions, they can all result in preterm delivery. And another interesting thing is if you're too young, or quote unquote, you're a bit advanced in age, that can also make you have a preterm delivery, especially if you're less than 17 years of age and you get pregnant, you have a high chance of having a preterm delivery. And then if you're above 35 years, and a lot of the time if you're above 40 years as well. So those are age categories that put you at a higher risk of having a preterm delivery. Another condition that actually predisposes to preterm delivery is when you have multiple gestation. So at the same gestational age, for instance, if you have a 32-week pregnancy, the mom who has a single fetus is at a lower chance of having a preterm delivery compared to the mom who has a set of twins or who has a set of triplets or quadruplets. So higher order pregnancies can actually predispose you to having a preterm delivery. And then some environmental conditions, which are very important. So these are things that we really need to know, because they are things that we can actually do something about. So if you take in alcohol, you have a higher chance of having a preterm delivery. If you are a smoker, you have a higher chance of a preterm delivery. If you indulge in recreational drugs like cocaine, cannabis, etc., you have a higher chance of preterm delivery. And then I think there's something about genetics. So I think it ties in with having a preterm delivery before predisposing me to having another one. It's been found out that, there are certain genes, even though still research is ongoing, but there certainly are some genetic factors that predispose to preterm delivery. So it's not a very exhaustive list, but these are the commonest causes of preterm deliveries that we have in our setting.
I see. Very, very interesting. So many causes, and you said that for some we don't know what causes it. The
Yes,
babies are just born preterm. All right. And
exactly.
you mentioned that if you have a preterm baby, you are at risk of having another preterm baby. You mentioned genetic factors, but there was a parent who wanted to know about spiritual factors. What do you say about that one? Are
So,
there
so
any
that's a very interesting, that's a very interesting question, and I'm glad the person has actually asked it. Because I know we are Africans, we tend to believe a lot in the supernatural, but they should believe me that there are no spiritual causes of prematurity. So everything is physical. Even though I'm saying that there are times where we really do not know the cause, but it's not because of some witch or because somebody is, so really,
All
there's
right.
nothing like
All
spiritual
right.
causes. Okay, all right.
Belinda Senaduku has sent us a hi. Emmanuel has said, thank you, Doc. Good to be here again. Gordon Ofela, be my boss, has sent us a thumbs up. If you've just joined us, please share to your pages, share to your wall so that people can see as well. We are talking about prematurity today. And you can see on the screen, our boss is called, our guest is called Dr. Sadio. Yes, a neonatologist from Cape Town in training. All right. So you've talked about the causes and the predispositions. Somebody wanted to know whether ectopic pregnancy is different from prematurity. What do you have to say?
Okay. So an ectopic pregnancy is certainly different from prematurity. So what happens in an ectopic pregnancy is that I think so you know that at conception, so you have your sperm meeting egg. This usually takes place in the fallopian tube, which is usually we would say the tubes. So what happens is that once the tissue or the cells, the ball of cells that is eventually going to develop into your baby, it's supposed to move along the tube into the mother's womb. That is where nature has actually, produced it or designed it in such a way that it can accommodate a growing child. So in an ectopic pregnancy, what happens is that the fetus or the baby, or let me say the ball of cells that is supposed to eventually develop into your baby, that not for some reason it gets arrested within the fallopian tube. So it doesn't get into the womb. And then what happens is that because the fallopian tube is actually not where the baby is supposed to grow, and it's really a tiny, very tiny, tiny structure, as the fetus grows, it kind of ruptures the fallopian tube. The mom starts to bleed. It's actually an acute obstetric emergency. So that is a pregnancy that has been interrupted and has actually turned into an obstetric emergency. Whereas with a premature delivery or prematurity, the baby actually rolls, and then gets implanted into the mom's womb, which is where you want it. And then it starts to grow, but for some reason, before baby is ready to come out, something happens and the baby is expelled into the extrauterine environment. So there are two very, very separate things.
All right. Well understood. Please share if you've just joined us and say a hi so we know you are here. Say a hi, leave a comment, ask a question so that we can deal very well with the topic. Now, there's this question about odd numbers and even numbers. And then when you talk about that, whether if a baby is an odd numbered baby has a higher chance of survival, a parent wanted to know whether it is true that babies that are female and premature have a higher chance of survival than babies that are male and are premature.
Okay. So I think I'll start with the second question, right? The second question is whether a preterm baby has a better chance of survival if it's a girl compared to a boy. Well, that is actually very true. That's one of the interesting things about prematurity. We really do not know exactly why, but several studies have shown that if you have preterm boys and you have preterm girls, preterm boys tend to have a more, let's say, a severe course in the ICU than the preterm girl. So the girl would start feeding earlier. The girl is able to wean to say room air or requires lesser oxygen than the boy. So certainly, if you want to come out as a preterm, you're better off coming out as a girl. You're better off coming as a girl, actually. But really, it's just about a 2%, difference. So you have about 95% chance of survival if you're a girl, and then if you're a boy, just about 93. So it's really a slight difference in the survival rate. Yes. Can you remind me about the other question again?
It's about whether when the baby is
The odd number.
numbered. Like
Okay.
my understanding is, if you are a first baby and a third baby and a fifth baby, you have a
Okay.
higher chance of survival. Yeah.
Okay. So that there really is, it hasn't been medically proven anywhere. I think it's actually, I think I can confidently say at this moment, with the evidence that we have and with the knowledge that we have, that there really there's nothing like that.
Okay.
There's nothing like odd pregnancies, them having a higher chance of survival. There's another way that I looked at it. I actually thought the person wanted to know whether if you're 31 weeker or you're 33 weeker. Either way, it really doesn't matter whether you are first or third. What I think may be an influence is that if you have a preterm delivery and you've had a baby before, then it's like it's not a new thing to you. You are better able to kind of handle a preterm baby with some guidance. So that may make things easier for you, make it easier for you to handle your baby, but not really medically proven as whether you are first or third. Yeah.
Okay. And you also said something that is interesting to me. You said that if a mother is too young, the higher has a higher risk of having a preterm baby, and if a mother is too old, has a higher risk of having a preterm baby. For the old, you mentioned some age. You said about 40, about 35, but then about 40 is the high risk is higher. But then for the young, you didn't mention the age. When is a mother?
So 17. A mother who is less than 17 years.
Okay.
Yeah.
Okay. All right. So thank you so much for joining. Please share to your pages and leave questions for us. If you have any question at all about prematurity, leave it for us so that we can answer. So another parent is asking, can someone who survived as a premature baby also give birth to a premature baby?
Yes, actually, there's a slim chance, again, a very slim chance that if you are a preemie yourself, then you can actually have a preterm baby. But it's a slim chance, and then what you need to do is optimize yourself as much as possible, do everything right and all that. But it doesn't necessarily mean that once you have that risk factor, you by all means. But there's always that slim chance that you can, and again, it boils down to your genetics again. So I think that is it.
Okay, there's a question about their future health, but then I think that we should now talk about what we can do as parents to help our premature babies survive. Because I think the reason we are talking about this is because they contribute a huge chunk to deaths among children, especially among newborns. Or I'm wrong? Is that so?
You are very right. You are very right. Actually, I am always very passionate when I say this. If you take death in children under 5 years, from birth to 5 years, the greater chunk of death actually occur in those who are less than a month. And it's really mind-boggling if you actually think of from age, say, 1 day to 5 years. And most of the deaths are actually occurring within the first month of life. And even among the first month of life, most are actually occurring in the first week. And within the first week, most actually occur in the first day of life. So there's really a huge burden of, prematurity and neonatal mortality that we need to actually deal with. So you are very right.
Okay. So what can we do? What can we do as a parent when you have a premature baby? What can we do?
Okay. So that's a good question. Now, when you work with neonates, one of the first things you realize is that the health of the baby is linked to the health of the mother. So usually once you want to make any change in the life of neonates, the first place you have to look is how well the mother is. So we always say that you optimize the mother very, very, very well. First, before you even deliver the baby. So make sure that mom is a healthy weight. Make sure you're having a pregnancy at a good age, for want of a better word. Make sure that you're on your prenatal. So make sure that you're on prenatal vitamins. We always say that, take your folic acid before you get pregnant. All these things, make sure you do them very well. And then make sure you plan your pregnancy. Because I think one of the risk factors for prematurity that I forgot to mention is if you're having pregnancies too soon, if you're giving birth, the birth interval is really too close, that puts you at risk. So 9 you want your pregnancies to be at least 18 months apart. So what I said, pregnancies, exactly. So if your pregnancies are 18 months apart, what it means is that your babies are going to have at least 2 years difference between them. Okay,
Okay.
so
Okay.
you try to optimize the pregnant woman as much as possible. And like I said, sometimes you do everything by the book and yet you still end up with a preterm. Now, once you have it, and then once you're pregnant, try and make sure that you immediately you realize you're pregnant, go to the hospital, get your labs run, you have your BP checked, everything. If they need to put you on medication, they start putting you on those medications so that later on your BP doesn't go up for them to need to extract your baby before 10. Now, if you do all these things, and unfortunately you still end up with a preemie, usually because they come out with difficulty in breathing and all that, they're usually with us in the hospital, usually in the ICU. Now we do everything, which we have an incubator that would try to keep them warm, but the things that we can do as parents, I always say three main things. The first thing is that help us to control infections in your baby. Just help us to control infections in your baby. Something as simple as hand washing. When you come in and we say wash your hands at the door, don't bring your phones in. Sometimes people don't understand. They think we are being fussy. They think that, okay, my husband is going to call. How am I going to receive the call? But you see, one of the causes of mortality actually in our newborns is actually infection. And the thing is that once you are born as a preterm, your immunity is down. Your organs are they are not resilient because they needed more time to actually grow in the womb before they come out. So once you are born, your immunity is low and you easily pick up infections. Germs that would not, affect or would not cause disease in a term unit will cause disease in a preterm. So when you have a preterm delivery, make sure that you are washing your hands around your baby. You are keeping, general hygiene, because we try as much as possible to practice hand hygiene when we are dealing with your baby. So you need to help us when you come in, because you are the mom. We really can't stop you from having contact with your baby. So when you come in, we say wash your hands, practice, good sanitary conditions and all that. Just help us by doing that. That is one of the things that you can do to prevent your baby, to actually increase the chances of your baby actually surviving. And then the second thing is breast milk. I think people we don't
When you are talking about breast milk, I'm so happy because I'm also, just like you are passionate about newborns, I'm also passionate about breast milk. For breast milk.
Yeah, breast milk is an awesome product. I mean, I don't know how else to. Breast milk it's so awesome that if you have a baby at 30 weeks, the kind of milk that you produce is just highly specialized for your baby at 30 weeks. If you have a baby at 30
weeks, specialized mean? What
it means is that it contains everything that your 30-weeker needs to survive. And if you are born at 34 weeks, your baby's organs are more developed to the point of a 34-weeker. And that breast milk that you are producing at 34 weeks is also contains everything that your baby needs to cross over from 34 to 10. So it's really the best. Sometimes people underestimate the effect it has so much. I remember going for a program and somebody asking me, okay, so if I want my baby to grow well, if I want my baby to be intelligent, what should I do? I say, make sure that you're feeding your baby very well. Make sure the nutrition that you're giving to your baby is very, very good. Now, the thing is that breast milk has all these antibodies that help to even fight the infections that I'm actually talking about. Apart from that, it helps your baby to grow. Your baby's intestines are actually not as well developed as for a 10 baby. And so when you give them formula, they're not really able to tolerate the formula very well. So typically what we'll find is that you start feeding them. If you have two babies who are preemie, the same age, all things being equal, and you have a mom who is very keen, who's trying as much as possible to give enough breast milk, you see that baby grows very well, tolerates the breast milk very well, because it's really easy to digest for the preterm intestine. But when you have a mother who's not very keen, who tries to rely more on formula, or you have to give formula because the mom is not producing breast milk for one reason or the other, you find out this baby, they don't tolerate the breast milk. They are vomiting, they keep vomiting, they are not growing. Then with time, you see that the abdomen or their stomachs will become very big, and then they develop what we call necrotizing enterocolitis, which is number one killer of our preterms. So nutrition,
like an infection of the intestine.
Like an infection, exactly, of the intestine. So you have a baby who needs to feed to grow, and yet you can't feed the baby. Sometimes they actually rupture the intestines, and then a lot of the time we are not able to save them. So help us to control the infection, give us breast milk, and then we have something we call Kmt. Maybe later on we'll talk about Kmt. It's a very simple procedure that we teach to parents that help a lot in the management of our preterm baby. And then make sure that your baby is getting vaccinated when they are supposed to get vaccinated. Sometimes people say, oh, my baby is so small. No, but you can still, once your baby is well enough, you can continue to give your baby the regular immunization at the same ages, So we do all that, and then these are some of the things that we can do to increase the survival of our preterm.
So I'm really enjoying the show. I'm enjoying, you said the parents, when you have a baby who is preterm, the parents should help us to keep that baby alive. And we do that with three main things. The first one, you said control infection, especially hand washing. The second one, give breast milk, which is one of my favorite topics. And the third one we are about to talk about is to give warmth. All right. Thank you so much for joining. If you have just joined us, please share to your pages. Share to your walls. I've seen several people on, but the comments are very few. Now, this is a question that we should answer before we go on. From Senna, one of our regular followers, he's asking, is it medically proven that premature babies are very intelligent than the normal babies? I think he means the term babies. So are premature babies more intelligent than the term babies?
I haven't come across any study like that. Really, the good thing is that with nurturing and with teaching and everything, they can't survive and they can't be as intelligent. But as to whether prematurity gives you an advantage over a term baby, no, I'm not aware of anything like that.
Okay. All right. And so we were talking about keeping them warm, and you started to mention Kangaroo Mother Care. If you could just describe Kangaroo Mother Care for us. But then there's a question on my mind. Let me ask before I forget. You said that these babies, we normally keep them in ICUs. But I am speaking from Ghana. We don't have a lot of ICUs. And even the ICUs we have are not well equipped. So are you saying that every preterm baby, and you keep calling them preemies, so preemies, premature, preterm, they are the same. So are you saying that every preemie or preterm baby needs to be in an ICU? Yes.
Okay. No. So actually, that's not what I'm saying. So the more preterm you are, the greater your chance of actually needing an ICU. So the preterm who's born at 29 weeks is more likely to need proper ICU care compared to the preterm. Remember, once you are less than 37, you're a preemie. So it can be a 36-weeker, and you would not need an ICU because your organs are more mature than a 29 or a 30-weeker. So there is that distinction. I think that sometimes we cannot just say ICU just to say that they need specialized care, but the more preterm you are, the greater the chance that you would require something.
All preterms are not the same. In other words,
all preterms exactly.
So it depends on how long you spent in the womb before you came out.
Exactly.
Kindly tell us about Kangaroo Mother Care.
Okay, Kangaroo Mother Care. It's a form of what's the word that I use? It's like a position that we put our preemie in. Now the thing is that one of the challenges with managing a baby who is born too early is that their ability to control their body temperature is not well developed. So they can either get too hot or too cold. But you and I, we're able to maintain our body temperature within very narrow limits. So one of the problems of the premature child is maintaining body temperature. So it's been found that it's a very inexpensive way of actually keeping the baby's temperature very close to 10, close to what it should be. So what typically happens is that you have a preterm baby who is usually just in a diaper. We put the baby chest to mom's chest, in between mom's breast, and then we have a tie. We call it the Kmt Binder, which is usually specially designed to keep the baby in position on top of the mother's chest. In fact, if you don't have the binder, you can use the normal cloth. So what it does is simply put the skin to skin contact between the baby and the mom. So baby is just in the diaper on mom's chest, and then having direct contact with mom's skin, and then you keep the baby. They usually would put the baby in a hat because they can actually lose heat from the head as well. So you do that, and because the mom is able to maintain her temperature within a very narrow limit, if she is able to transmit that temperature to the baby, so the baby doesn't get too cold or too hot. And that has been found that it's almost sometimes even better than even putting the baby in an incubator. So that's one of the advantages for those of us. If you are in an area where you don't have lots of incubators, that's another thing that you can do. You can actually just do KMT. That will help with the temperature control of the baby. In fact, it's even done everywhere in the world. Yes. So that's one of the advantages. That's the main reason why people put baby in KMC position. But it has other lots of other advantages. One of the things is that your baby is very close to you. So your body is constantly reminded that there's a baby, and it helps even in producing more breast milk. So even on the wards, you find out that those moms that come in and do full KMC, they lactate better than those moms who go home and come. You see, so it helps in better lactation because and it helps you to bond with your baby. Now, another advantage is that, these babies, they tend to vomit a lot. Like I said, all the internal organs are not well developed, so they tend to vomit a lot. But once you put your baby in the KMC position, what we'll say is that gravity keeps the food down. So your baby is better able to tolerate the food, and then they gain weight better. It's really amazing. So sometimes all you need is to do in a baby who is vomiting is encourage mom to come stay in, put the baby in KMC position, feed the baby in KMC position, and you'll be amazed at how well that baby will do. Another advantage which I usually say and make sure I tell parents is that it actually helps with even infection control. Because what happens is that, let's say you have a preemie or a preterm baby who's come into contact with a germ, maybe in a normal or a regular handling of the baby is come, some of the, most of the germs, they actually go through the skin. So if this baby has germs on his or her body, and you, the mom, you put the baby in KMC position, what happens is that these germs get transferred onto you as the mother. And we say that because you, the mother, your immune system is strong, you are able to produce antibodies to fight the germs. The antibodies go through the breast milk, and then when you give it to your baby, it protects your baby from getting sick. And it's so amazing. It's so amazing. It's one of the things, take it from me, if you want your preterm baby to survive, just be serious with KMC. Wash your hands and give us breast milk, and you'll be amazed the difference it makes. Yes.
Excellent presentation. Excellent presentation. So these are the things that we can use to make sure that, or we can do to make sure or help our preterm babies to survive. Excellent. Yes. So it means that even when you live in an area where there is no incubator, or there are incubators, but the numbers are not enough, this is a way that you can keep your baby warm. You just carry your baby on your body in front of you as if it's a pouch. It's named after the kangaroo who keeps their babies in a pouch. And then you cover with a cloth, make sure the baby's head is also covered. And then all these wonderful benefits that you have talked about are there for the baby. All right.
And then let me just add one last thing. The reason why we love KMC so much is that, imagine, it helps us to actually discharge the babies very early from the ward. So, and then the other advantage is that, imagine if you're a mom, your baby is attached to your chest, your two hands are free. You can wash, you can cook, you can do everything. So you don't always have to sit. Typically way back when people are holding our babies, and then you are not able to, you need somebody to do every other thing for you. But put your baby there, and then you can do everything. You can even sleep with your baby in the KMC position. And then the good thing is that when you are tired, your husband can take up. So sometimes we jokingly say there's also KFC, which is Kangaroo Father Care. In fact, any member of the family can actually take. But once mom is tired, just make sure you are clean enough, and then you can put the baby in that position. And then throughout the day, baby is like
so
that.
The fathers, you are not left out. You can do Kangaroo Father Care. You can also give that one to these babies and help them to grow. As long as you are clean, you've had a bath, that's all right. We have a question from Emmanuel, who says, do preterm babies have to delay their vaccinations? If you say yes, then you have to give us age limits. And if it's no, then it's no. Yeah.
So I'll say that it's no. The answer is no. It's just that when they are very ill, for instance, they are very sick, you really cannot start immunizations. But once they are well, they can have their immunizations, and they have it at the same ages. So let's say you have a 34-weeker who say is out of hospital maybe within a week. You can start. The baby can have their immunization on the same day that a baby who was born at 10. Do you understand? So we don't need to delay or say, okay, let's correct for the age before you give your immunizations. You usually would have to wait till they are stable. But once they are stable, they continue their immunization. They don't need to delay. So that's one thing that's very important for us to know. Yes.
Okay. I invited some public health nurses. I don't see any of them on the call, but I hope they will watch on replay. And anyway, if you've just joined us, hi, leave a comment, leave a question, share to your pages as well. So because there is this question that Emmanuel has asked, it has come to my attention several times. And I have heard feedbacks like they don't have enough muscle to hold and give the injection. So the public health nurses or the community health nurses they find it difficult to give the injection. But then I think that also there's just this fear. There's just this fear that the baby is too tiny. But our
Exactly.
dermatologist is saying that they don't have to delay their vaccinations. All right.
Exactly.
Okay.
Exactly. They don't have.
All right, all right. Countess Selassie has joined us, says that this is very educative. So I hope that you have shared to your page. Please share to your page and your wall so that everybody can see as well and ask their questions. Okay. So what is the survival for preterm babies?
Hmm. So actually, there isn't one answer to this question that you've asked. Your survival actually depends on, let's say, two main things: where you are born, which is very important. So, if for instance, if you are born at 24 weeks in Ghana, for instance, or let's say in a low-income country, your chances of survival is very, very low, extremely low. But if you are born at the same 24 weeks, all things being equal in the United States of America, you have a better chance of survival. So there is really not one single survival rate for every place. You understand? And so it depends on where you are born. The first thing depends on actually where you are born. And then, so we actually do have something we call age of viability, which I tried to even mention in the beginning. So in Ghana, for instance, when you're born before 28 weeks, we say that you are born before the age of viability, which means that the resources that we have to ensure that, or to give the care that such a baby would need in order to survive, we really don't have it. So most of them don't actually survive. So if you're born at 27 weeks in Ghana, for instance, we say, okay, you are born before the age of viability and you may not survive. You'll have a very high chance of not surviving. But in the United States of America, for instance, their age of viability is like 24 weeks. In fact, even newer studies are putting it even down to 22. So if you're born at 24 weeks, you have a higher chance of survival. WHO would come out with overall, but it really depends on where you are born. And then even within the same geographical area as well, it also depends on the age at which you are born. So obviously, if you are, the more preterm you are, the lesser your chance of survival. Because if you are 31 weeks, all things being equal, your chance of survival is lesser than somebody who's 36 weeks. And then even for the same gestational age, so if you are both 34 weeks, the one who picks up an infection is less likely to survive compared to the one who doesn't pick up an infection. You understand? The one whose mom is giving us breast milk and doing all the right things has a higher chance of survival than the one whose mom doesn't.
So
I don't know.
breast milk will keep these preterm babies alive. I just
I'm
laugh.
telling you. I'm telling you.
Talk about breast milk. So
I'm
breast
telling
milk
you.
will keep them alive. Even if you can afford formula or cow's milk or something else, breast milk will help to keep the babies alive. Okay. Then tied to that question, do survivors of prematurity have future health issues?
Yes, actually. And so like everything in medicine, there are really conditions attached. I say yes because the more preterm you are, the higher your chance of actually having future problems. So the preemie who was born at 28 weeks or 29 weeks, who has had a very stormy course in the ICU, has been on, say, a breathing machine, which we call a ventilator, who's had infections, who's had a bleed in the brain and all that, is more likely to have future problems than the preterm with the 36-weeker who has a fairly smooth course. So they do have future health problems, and it's usually in those babies who are very premature, especially those who are born at less than 1.5 kilograms and those who are less than 32. We tend to see most of the problems in this age group because of the kind of care that sometimes just from the prematurity itself, and then sometimes from the kind of care that we give them. So, for instance, it's been found that usually conditions such as diabetes, hypertension, and other chronic conditions are more likely in a person who was born a preterm. So, in fact, nowadays people are even advocating that you should ask people's birth histories, especially when they have all these chronic conditions, because there may be a link. Now, the other thing is that before even these things that I've told you, I'm talking about in adulthood, but still within childhood, there are certain chronic conditions that a preterm may have. Like sometimes they may have problems with their eyes, especially when they are very young, like less than 32 weeks, and they are needing lots of oxygen. You give them oxygen because you need them to breathe better. You need them oxygen to supply their brains, but too much oxygen also hurts their eyes. So then they can actually develop blindness just from the fact that they were preterm, they needed oxygen. So there are things, few problems like that can actually arise from the fact that the baby was born premature.
Interesting. But you said something that, even though I am not surprised because I've heard it so many times, it has saddened me. You said that your chances of survival depend on where you are born. About 3-4 weeks ago, there was in the news a baby who was born, I've forgotten the country, I don't know whether it was in the States, as about 400 grams, and the baby survived. And I was just thinking, wow, wow, wow. You know, so this is not really medicine, but so, I mean it's so sad.
It's
It's so sad
happening,
just to
yeah.
know
It's
that
happening.
where you are has so much to do with whether you live or
What
you die.
happened?
Anyway,
Yeah.
so Selassie is asking us a question.
Now, can I just chip in something? And what you're saying, just in line with that, I think it's because we don't prioritize health in general and newborn care in particular in certain places. Like where I come from, I mean, you have preterm ICU, you don't have a ventilator. So obviously if you come out, you're less than 28, 29, you are going to die. But if you are born, say, in South Africa, for instance, there are ventilators and there are ventilators. You will be put on a ventilator and then you are more likely to survive. So it's because we don't prioritize health in general in certain places and newborn care in particular.
So I hope that somebody who is close to somebody, or there's somebody himself who has the power to make decisions, is listening to us.
Exactly. Exactly.
Somebody was born the size of an apple in another country, and that baby survived. But here we are struggling with sizes of big pawpaws and mangoes. We are struggling with them. It's so
I'm
sad.
telling you.
I hope that, in a few years, the story will change. We will come and say, oh, previously it was this, but now it's better.
Yes,
And I'm praying
that is what we hope for.
Amen. So Selassie is asking, what will my baby look like? I feel like she's asking, when a baby is born preterm, what does the baby look like? I feel like, but she's still on the call, so you can make that clearer if she wants. But I feel like what's
I suspect that is it.
Yeah.
So there are certain features of preterm babies that that points to the fact that maybe this baby was born preterm. So for instance, maybe a neonatologist can actually can get to a ward and know if they say, okay, this baby is 30, this baby is 10. You can look at the baby and say, no, this baby is not 10 because of certain features that you see. I mean, so all things being equal, your baby is smaller than the normal birth weight of a term baby, and they usually have very thin skin. You know, their skin is very thin. We say it's very thin and gelatinous. I don't know the easy term to use, but it's quite thin.
Like
you know, if you have a protein, gel-like, exactly, thin, and the more preterm you are, the more gel-like your skin is. And then you see that you find that their veins are actually very visible under their skin. So the more preterm you are, you see that the skin very thin, very gel-like. Then you see visible veins. If you look at their breast tissue, for instance, they don't have a lot of fat parts. So you see that the nipple is flat compared to a term baby who you can actually see a mound of a breast. You understand? You see that the nipple is on the breast, but for a preterm baby, it's almost flat and maybe just a tint there, you know. And then they have this thing in a term baby. Preterms tend to have lots of hair. We call something lanugo hair, which they tend to have a lot of it. And then as they grow, it comes down. And then usually when they're a fully term baby, they have what we call vernix caseosa. There's this gel, like this cheese-like material. For those who had term babies before, you know, baby comes out and there's this whitish thing on the baby's skin that the midwives, you know, have to clean. If you're preterm, you don't have all that. So those are some of the pointers. Sometimes even the pardon?
Should we be frightened? If
no, we shouldn't be frightened. Certainly when the baby is small.
The skin is like gel, as if it's melting under my hand, and it's looking all red.
Well, yes, I think that when you are not trained, the first thing is, oh, the baby is so small. So, you know, interestingly, sometimes the mothers come in, their babies are in incubators, and they are standing, you know, with their arms behind them. They are looking into the incubator because they are scared because the baby seems so small. Meanwhile, if it was a term baby, the first thing mom wants to do is to hold the baby, which is understandable anyway, but you shouldn't be afraid of them. It's just that they need more care. You need to be more gentle when you're handling them. That is all that we need to do, not to be afraid of them.
Thank you so much. We have another question from Selassie asking, does exposure to caffeine during pregnancy lead to preterm births?
So there are lots of things. You know, caffeine is a stimulant. I really don't have studies to back that, but caffeine and all these stimulants, all these even these recreational drugs that I was saying, they are all stimulants, and then they can lead to preterm delivery. So I mean, I'm not too sure, but certainly if you overindulge anything that you overindulge in, occasional caffeine here and there or coffee here and there, fine. But if it's something that you are doing and something that's stimulating you all the time, that will not be good for your baby. Moderation is key in everything. Yes.
Yeah. Yeah. So I think we answered the question the way Selassie intended, because she's thanking us for framing the question for her. Emmanuel, hi, you just joined. Don't worry. If you just joined, you can watch on replay. And still, if you are on replay, you can leave the question. We will attend to it, even outside the live show. Just drop the question and we'll come and answer it on Facebook for you. And please share. Don't forget to share so that others can see as well. Okay. So if you have any questions, please leave your questions and we'll answer them for you. And if you have comments, anything, we'll answer them for you. And even after the replay, like I've said, we'll get to it. We have another question. What is the reason for premature babies putting on more weight after 3 to 5 years than normal babies? So now I think that this person has probably had some experience with premature babies. Yes, probably. So he's asking, what is the experience, the reason why premature babies, they initially don't put on weight, but after some years, they tend to put on more weight?
Well, I think it's more of what we do to them when because when they are born preterm, we are encouraging them, feed them every 2 to 3 hours, feed them, so moms are very, into getting that baby to gain weight. Sometimes we actually overdo them, and then we actually predispose, especially when we are doing formula feed, we tend to make babies put on a lot of weight. So we tend to overdo them, and then they now catch up, because the expectation is that they catch up and then later they go at the same rate. But sometimes you overdo it and sometimes you overfeed them. If you are not overfeeding them, there are certain, it may be difficult to actually explain to understanding, but it's actually been found that one of the future health problems is that it actually does increase the risk of obesity. I think it has to do with what the changes that occur in the baby system as the baby comes out premature, as we are trying to feed the baby and all that. So that it occurs as a result of a very complex processes that may be difficult, but it's not a must, or it's not something that says that every preterm baby would end up gaining more weight maybe after 5 years or after 2 years. But a lot also does depend on the person's genetic constitution, I would say. So if you are somebody you easily put on weight, they are more likely to put on weight, even though you're a preterm. It may not just be just because you're a preterm. It may just be the person's genetic constitution that predisposes to him or her putting on weight, but not too much the prematurity. Even though it's been known that if you're a preterm, you're more likely to become obese later in life. Okay. So it's a mixture of.
I feel like the preterms, especially here in Ghana, where I am speaking from, I feel like because they tend to have a very difficult initial days. The smaller ones, especially in the initial days, they have a very difficult journey. They get dehydrated. Like you said, their intestines are not well developed, so they have problems feeding. And if the mother hasn't got breast milk and we are feeding formula, then they have problems. They are spitting up all their food. They get infections. So I feel like all those things sort of work against them in the initial days. But then as they grow up,
later they catch up,
more developed, and they catch up. Then the parents are so happy that my baby is then we are,
and then they feed. Exactly.
But initially they tend to grow very slow because
exactly
a lot of things are like they have all these things, infection, they have bad jaundice, they have this and that, and then we are poking them, taking blood all the time because we need to take the blood. Okay, all right, thank you. Someone asked, that is Emmanuel Francis, is asking us about the percentage of survival for preterm babies. You answered this question before he joined. But I think that if you can just say a word or two about it for him. What's the percentage of survival for preterm babies?
So I was saying that it depends on where you are born. So there's not one single percentage that goes around the world. It depends on where you are born, the kind of structures that are put in place, the kind of health system that is available to support you at that gestational age or at that age that you are born. And then it also depends.
Born in America.
Yeah, if you are born in America, you have a better chance of survival. And then it's even different. It's different for different institutions. For instance, the survival rate, for instance, in Kolibu will be different from the survival rate in Konfanochi and from maybe Tamale Teaching Hospital. So there are huge differences, you know. And I think a lot goes into it. Whether everyone at the same gestational ages, the one who's prone to infection or the one who picks up an infection, the kind of feed that is being available, whether the mom is doing KMT. So all these things actually affect the survival rate. It's not one figure that we can say this is the survival. No, it differs between geographic areas and then even within the same country and then even within institutions as well, between institutions as well.
Thank you. We have another question from Selassie. Seeing that we are both pediatricians and it's been a long time since we did obstetrics, I don't know whether we can do justice to it.
Yes, let's try.
What are the different ways of identifying preterm labor?
So I think that, you know, as for labor, you're talking about pain and you're talking about contractions and pain. So if you're if you're a pregnant woman and at any point in time you feel like your tummy is, sometimes the contractions are not painful. So anything that is different from what you are used to, you should report it. But usually what will happen is that you have some pain, usually lower abdominal pain, you feel your tummy contracting or the uterus contracting. Sometimes you feel your waters break and then you find that your water is broken and then there's fluid coming out. That's one thing. Sometimes you call something the show. If you find that all of a sudden there's this mucus plug which has blood in it and then you are passing it, those are all things that would point to the possibility of you having a preterm delivery. So I think Sarah, you can add to that. But those are the big things that would point to you possibly having a preterm labor. And then that's the reason why we say that anything that deviates from the normal, you quickly go to the hospital. Because there are actually ways to stop contractions in order to sort of let the pregnancy advance a few more days or weeks. So it's not the end if you start seeing signs of labor.
Okay. So if you see anything out of the ordinary, like pain, like water is coming out from under you, a little blood, please go to the hospital and let them see. Probably they will be able to help you, and then you don't go into preterm labor. So we have quite a number of people giving us hearts and thumbs up, but unfortunately, for whatever reason, I can't pull up the name. So if you're giving us a heart and I don't mention, please don't be offended. All right, thank you so much. So we want to take as many of your questions as possible. We want to take as many of your comments as possible. You can still give us hearts and thumbs up, even though I'm not able to exactly see right now who is giving us a heart or a thumbs up. Yes, and we are talking about prematurity. This is Baby, Child, and Co. If you just joined us, please share to your wall, your pages, so that others can also hear what we are talking about as well. Dr. Salimenu is a neonatologist in training who is doing this for us free, and we have a blog that you can visit, and we have a lot of interesting articles for you to help you, guide you as you parent your child. We have a community forum where you can ask any question. You get reliable answers from those questions. It's free. We have a parenting club that you can join. It's also free. The only problem with that one is that you want to be able to read, because we reach you via email. All the information that we give you is via email every week, every single week, unless something very unusual has happened. We reach you and we give you information that is relevant to you according to the age of your child. So you can do that one for us as well. Selassie is thanking us. Says Akbe. All right. We are still talking about prematurity. I don't see any questions here now, but what you can do is that even if you are watching us on replay, you leave your question or your comments. We'll come back to the page and answer them one by one for you. So if you just joined, don't feel that you don't have the chance to answer any questions at all. Okay. So I don't know, we are about 7 minutes away from the end. If you have questions, let's have them quickly. But Sally, I don't know if you have any general things to say, questions that haven't come up, but general things that you want to say about prematurity.
Okay, so like I said, I think I kind of have summarized a lot of the things. One thing is that you may do everything right and yet still have a preterm delivery. But there are also certain things that if you do right, it would decrease your chances of having a preterm delivery. And I think if there's one thing I want to stress upon is that let us make sure that we are optimal as mothers, as women, before we have a pregnancy. So you plan your pregnancies healthy weight, healthy age, make sure you're attending antenatal care. And then if for some reason you have a preterm delivery, you help us to make your baby survive, like I said. Hand hygiene practices, breastfeeding, making sure you come along with us, your Kangaroo Mother Care, and all these things. And then if you know somebody who knows somebody who knows somebody who can help us, better the kind of care that we are giving to our newborns, especially in Ghana, please link up and help us. Let us share the video. Let people know that premature delivery or problems with newborns are really an issue for us. In fact, it's our newborns that would become our future president. So if they are compromised, then you know that the whole nation is compromised. So let us take an interest in our newborns. Let us, get upset that we don't have proper ICUs in some parts of the country. Let us, try and help us when you hear things, when you hear that we are advocating for things, when we are marching to Flagstaff House, when we are trying to get our leaders to get involved and interested in
Yeah.
newborn care, just come along and help us to
Yes.
do it.
But you didn't
Okay.
talk about my favorite breastfeeding. You know what? Last week I did a video on the reasons why you should breastfeed, and then somebody sent me a message and asked me, are breastfeeding rates going down in Ghana? I knew the answer was yes, but then I needed to Google so that I can give her facts and figures. And then when I went to research, I realized that only 1 in 2 mothers are able to initiate breastfeeding early, and then only 45 or so mothers are able to do exclusive breastfeeding. But here we have said that if you can breastfeed your preterm, you enhance the chances of survival of that your preterm baby. And by this, I'm saying that there's a YouTube channel, Baby Child and Co. So find us on YouTube and subscribe. Okay, it's when you subscribe that we can have the Vim, and then hopefully one day we begin to pay for this because everything is free. So find us on YouTube and subscribe as well. Okay. Selassie is also asking again, what is the best growth chart for growth monitoring of preterm infants? In other words, are we using the same chart that we use to monitor term infants to monitor the preterm infants?
So we actually have a different chart to monitor the growth of preterm babies until they catch up. So we have the Fenton's growth chart, which will help you to correct. So a term baby is born at 40 weeks. So you can have a chart that will give you the expected weight of your child at 31, 30, 28, 29, 29, 30, 31. So we have a different chart to monitor the growth of babies. Yeah, exactly. We have a different
chart
chart
for preterm babies or premature babies. Okay.
Exactly.
Right. And you did mention.
I don't know if I can say this. You mentioned about our breastfeeding rate, and it's really bad. It's because a lot of our institutions are actually not baby friendly. Because Sarah, you and I are doctors, and usually the most you have when you have a baby that is if you keep your leave of about 2 months, you get 3 months maternity leave. That gives you 5 months. You start working, and then it's difficult to. You may try as much as possible to express, but it's difficult for you to have enough. By the time maybe by afternoon the breast milk that you've left at home is done, and then your baby has to do for, which is very, very, it's very bad. It's very pathetic. I think that is something that institutions need to, to look at. I think recently there have been talks about trying to extend our maternity leave and all that. Those are all things that we need to do. Things that we need to do on the side to actually help us to get better survival in our babies in general, in our preterm units in general. So we need to be baby friendly. If you're an institution, have a place where you have, your staff can breastfeed and do all those things. That's one big thing that we can do. To help in the survival of our children.
Yeah. Very, very important. During the week, I attended a training or a teaching or lecture where the lady was saying that she was a course coordinator for a certain postgraduate program in Legon. And then she found that the lectures were from 3 p.m. to I think 7 p.m. or something. She found that many people were not coming. They had excuses. So she found a small space where they could bring their babies with their nannies and so on. And then the class attendance more than doubled. So if you're an employer listening to us, please make it easier for the mothers to breastfeed their babies. Provide a small space where they can come. When you do that, you actually realize they work better because they will take less off because their babies are sick. When they are there, their mind is concentrated on what they are doing. They are not there and their minds are with their kids at home. Let's take this question. We talked about the problems that preterm babies may have in future. And Senna is asking, is there a solution? How can we prevent the future problems that these preterm babies will have or may have, because it's not all of them. Yeah.
Okay, so that's the thing. One of the things that you can control, for instance, I talk about eye problems. We try as much as possible to limit the amount of oxygen that we expose these babies to. So if they can breathe better with low oxygen levels, we try as much as possible to do that. And then we try as much as possible to, like I said, low oxygen levels, and then try to, if they have a less stormy course in the ICU, they tend to have reduced the lesser chances of actually, having all these chronic conditions. So we would say that if you let's help us to all the way, it still boils back down to preventing infections, making sure that your baby has a less acute course, so that then they don't get all these complications that in the end can result in them having all these other illnesses that we've spoken about. So make the ICU course less stormy, and then think all the other things will kind of
reduce. With breast milk
exactly.
And with Kangaroo Mother Care.
Exactly.
So Aziz is giving me a thumbs up. Congratulations. Okay, we plan to do this for an hour, and an hour is up all too soon. But if you are watching us on replay, don't worry. Ask your questions, ask your comments. You can share, even if the live session is over, you can share so that more and more people get to view this. And we thank Dr. Salimenu so much. She's here with us from Cape Town. She's been dealing only with neonates, newborn babies for I don't know how many years. So though she's a pediatrician, she's more of a newborn babies doctor than anything else. So we say a very, very big thank you to her. Everything we do is free. And so when people come, we need to appreciate them for their time. Joyce says this has been very educative. Thank you, Joyce, for always being with us. So thank you so much, Dr. Salimenu. So we've done this under the auspices of Baby Child & Co., which is an organization that does child health education. Again, everything that we are doing is free. You don't pay anything for it. So visit our blog, join our parenting club. We will guide you free of charge. You basically have pediatricians at your beck and call, free of charge. You can join a forum where you can ask questions. You can see the questions other parents are asking as well. We ask that you read the things that we put on our blog. We ask that you subscribe to our YouTube channel, you watch the videos. That's the only way you pay us. We don't take any money from you for that. And thank you so much for being with us. So if you have a pregnancy close to term, you can join the parenting club. We will take you through to when you have a newborn, and then we'll continue from there. If you have a newborn, join us. If you have a baby who is 6 months old, 1 year, currently our services, which we will expand as we grow, it's all the way up to 8 years for now. And then everything is free. So join us, and then let's help you as you parent your child. So thank you so much. And remember to ask your questions. Thank you, Dr. Salimenu. Thank you.
Welcome.
Thank you. This session has ended now. See you in the next one in December. We'll have another session.
Okay. All right. Bye-bye.